This is Glomus tumor. Gross picture. We can see a little bit red tumor just under the nail bed. This redness lesion tumor is really painful. Usually occurs in the distal extremity, particularly in the nail bed. Let's see the microscopic feature of the Glomus tumor. So in low power, we already know that this is a well-demarcated circumscribed tumor just in the dermis, not any connection to the epidermis. And we, even in low power, we know this should be a benign lesion tumor because that is well demarcated, symmetric. When you cross the line here, left and right, it looks identical, relatively small. So, and in this power, you may see some highlight stroma, some empty space, really highly suspicious as a blood vessel. Then let's zoom in a little bit. So we can see this bluish small cell kind of really monotonous, but they have a growth pattern just like they always try to surround this blood vessel, try to trigger surrounding them. Even when there is the vessel go out of the lesion, this cell also would like to hugging the blood vessel endothelial cells. And then higher power to convert the cytology, really round cell, every cell looks identical, monotonous, no mitotic figure, looks really bland. So when you have all of these features, you can call the diagnosis of Glomus tumor. So just remember, if you see anything well circumscribed in the dermis, try to hugging around the vessel, the cell is monotonous, really highly suspicious, Glomus tumor. Then this lesion, when you do IHC, that is more muscle actin positive, because this is a true cells we call parasite. Parasite is the small muscle originated cell try to hugging around the vessel. They are regular normal function just to regular your blood supplies in the extremity. When in the cold weather, they will try to shrink the blood vessel and try to make sure our other organ had enough blood supply. So this is the function of the Glomus cell. This is another example of Glomus tumor. Again, we know that it's well demarcated lesion, and even low power, we know a lot of blood vessel inside. Even we can see some red blood cell. And then the other component is the Glomus cell. They look really monotonous, round. You may also thinking, is it just lymphocytes? But you zoom in, you can see all the cells look monotonous, and then they just try to trickling around the blood vessel. When you see the blood vessel go out, this cell also going out, so that is really characteristic for a Glomus tumor. Let's see one more sample. This one is bigger, maybe in deep soft tissue. This one seems in the kidney. We can see glomeruli, but we can still see the same process here. All these monotonous blue cell try to surround the blood vessel. See, all of these cells are monotonous. So this is another example of Glomus tumor.